Good morning everybody. Today we are going to see a different topic, that is Iastm. Instrument assisted soft tissue mobilization is one of the most popular recent methods introduced in physiotherapy to reduce pain and improve range of motion. Iastm uses specially designed instruments to provide a mobilizing effect to scar tissue and myofascial adhesion. Using instrument for soft tissue mobilization is theorized to increase vibration sense by the clinician and patient. The increased perception of vibration may facilitate the clinician's ability to defeat altered tissue properties. The Iastm treatment is thought to stimulate connective tissue remodeling through reabsorption of excessive fibrosis, along with inducing repair and regeneration of collagen. Our instrument is thought to provide a mechanical advantage for the clinicians by allowing deeper penetration. The idea behind the introduction of our Parc Iastm tool is that I was thinking to make an Iastm which is simple, user-friendly, anti-allergic, unbreakable and durable to release myospasm. The final outcome is Parc Iastm tool. We have a example video here regarding the application of Iastm. Prior to release, apply some petroleum jelly over the affected area. If your patient have neck pain with limitation of neck movements, with these tools help, we can bring magical results by releasing trigger point of upper trapezius, levator scapulae, sternocleidomastoid and suboccipital. Depend upon muscle fiber arrangement, the application of the tools differ. For example, sternocleidomastoid arrangement is in vertical direction, so we mobilize the muscle in horizontal direction, but lower part of the trapezius is in horizontal position, so we have to release in opposite direction. This Parc Iastm tool will be so much worthful for every physiotherapist. For further clarification, visit our website www.parciastmtools.com. Thank you.